Hello, how are you? Plaque in the carotid artery is one of the major problems for your brain, and it might be growing right there in your neck without you even knowing, because after all, carotid plaque doesn't cause symptoms. It don't get a fever, you don't feel pain. When a person finds out they have plaque in the carotid artery, it's often because of this. After having a stroke or some kind of hemorrhage, that's when the problems related to after effects appear. You probably know someone who has had plaque in the carotid artery, the plaque broke off, and they really had some kind of complication. These complications can involve cognitive issues, motor issues, and the person never has the same life they had before. So, it's extremely important to prevent the appearance or growth of these plaques in the carotid artery. Today, I'm going to tell you about 7 things you can start changing right now in your lifestyle and your diet that can help you. You're going to love this video. Stay until the end because you won't want to miss it. Before we start, I want to ask you if you've ever had any tests done to check how the plaques in your carotid artery are, or if you have any family history. Has any grandparent, parent, your mother, or anyone in your family ever had a problem with their carotid arteries, developed sclerosis, or had any kind of complication related to this? Write down here in the comments how old you are. I would love to see your comment. A lot of people don't know why. After all, this plaque forms. It happens in the carotid artery. Before anything else, I want to tell you something. What is the carotid artery? Many people don't really know. The carotid arteries are 2 major arteries that run up along our neck toward the brain. So they're kind of like highways, with the blood traveling along this large important road to supply the brain. They have a large diameter, so they carry a big flow of blood from our heart to the brain with oxygen, nutrients, everything our brain needs. When we have an excess of LDL, we can end up having some kind of complication. When we have an excess of LDL, glucose, high blood pressure, uncontrolled blood pressure, small lesions can appear on this highway, this artery, and our body, when trying to fix this, ends up depositing fat, calcium there. And that's where atherosclerosis begins, which is like small plaques that form on this big road, this artery. The problem is that this is like rust in a pipe, so to speak. So over time, it keeps building up, and depending on how your body responds, you might end up with even more calcium and fat being deposited there as your body tries to fix the problem a bit. The oxidation of this cholesterol can happen, and we know that's really bad. This can end up causing a blockage. In some cases, this blockage breaks loose, and since it's an artery, it travels up to the brain. And for many people, this can have bad effects. It can cause an ischemic stroke, which happens when blood can no longer properly flow to the brain. There can also be other types of complications. Some people also call it a brain attack, and it can cause serious problems affecting quality of life or even being life-threatening because depending on the area of the brain that's affected, where this clot, actually this plaque, it's not a blood clot, but where this plaque with calcium, fat, inflammatory factors, platelet aggregators, wherever this goes, depending on the area where it gets stuck and blood can't reach, it can affect your motor skills. It can affect your cognitive abilities, or the person may even end up dying. So it really is a health problem. And we have to prevent ourselves from developing this atherosclerosis, these plaques, right? Especially in the carotid arteries, as we've already seen, which can have major health consequences. Now let's start talking about 7 things that are scientifically proven to help prevent this. So, what is scientifically proven? One of the main things is diet and directly targeting the enemies of plaque, which as I told you are 3. They are LDL, the bad cholesterol, blood pressure, and blood sugar. Statins don't just lower cholesterol. They also reduce inflammation inside the plaque and make the vessel wall, the artery wall, firmer and less likely to rupture. It's as if it turns that soft and potentially dangerous plaque into a more scarred, hardened plaque, so to speak. So many people, when they have this atherosclerosis, the doctor prescribes them this medication, statins, to try to keep it under control. I have an entire video here that I made recently talking more about statins. I'll leave it down below in the description for you. Besides that, of course, good control of blood pressure and good control of glucose, blood sugar, will prevent the progression of microscopic lesions. Keeping glucose balanced even prevents the oxidation of bad cholesterol, LDL, which I told you is very harmful. So when you manage to control cholesterol, blood pressure, and glucose, it provides good vascular protection, especially for such an important artery. The second step is to really take care of your diet, as if you were treating an illness. In other words, with responsibility. Because diet is an extremely powerful weapon to fight atherosclerosis. A diet rich in soluble fibers, such as oats, flaxseed, psyllium, and chia, can be a great option for you because they help eliminate excess cholesterol through the stool. In addition, these fibers will regulate glucose, as you saw, is also closely related to inflammation. The healthy fats from olive oil, avocado, chia, and flaxseed help improve HDL, increase good cholesterol, and reduce the oxidation of bad cholesterol, which is one of the major triggers of arterial inflammation. Fatty deep-water fish like tuna, sardines, and salmon are good options. As I mentioned, chia, flaxseed, avocado, and olive oil as well. Plant-based sources are also good options to add to your diet. Another very important thing is to reduce as much as you can, ultra-processed foods, sugar, and trans fats, because they stimulate the formation and instability of this plaque. So, what you eat can literally influence this plaque, either contributing to its hardening, clogging the arteries, increasing fat deposition and inflammation there, or on the other hand, helping to prevent those processes. So, making good food choices can be crucial for the progression of this problem for you. The third thing is to exercise. Some people are afraid that physical exercise will dislodge the plaque and actually cause the problem, but scientific studies say the opposite. Exercise stabilizes the plaque because it helps reduce systemic inflammation and improves endothelial function, the function of the blood vessels, the inner lining of these arteries, as I mentioned to you. And studies show that people who are physically active have less progression of carotid atherosclerosis and plaques with higher fibrous content, making them less likely to rupture. So it's very important to be more active in your daily life, and preferably to engage in physical activity. If you have no contraindications, this is usually what's recommended. It's 30 minutes of moderate physical activity 5 times a week, totaling 150 minutes per week. Remember that if you can also add other exercises to your daily routine, going down the stairs, walking around your house, even just 15 minutes inside your home after meals, it will greatly help with glucose control, weight management, and reducing inflammation in your body. Be careful with cigarettes and smoking in general. Both active and passive smoking can significantly harm cardiovascular health and increase the risk of serious heart problems. And every puff people take releases a lot of free radicals. These directly damage the walls of the arteries, making it easier for cholesterol to stick and accelerating the formation of plaques. So, quitting smoking drastically reduces the risk of stroke within just a few months, and it is one of the steps that yields the fastest results you can take. If you smoke, quitting will have a hugely beneficial impact on your cardiovascular health, on the health of your arteries, and specifically your endothelial health. I have a video here on the channel talking about how to quit smoking without gaining weight, because I know that many people are afraid of quitting smoking and gaining weight. So I'll leave that video linked below. If you need to, seek out a psychologist or psychiatrist to help you with this as well. In some cases, the doctor may prescribe you medication to help control plaque. Obviously, this should always be done after medical follow-up and diagnosis through exams. But in addition to statins, other medications such as aspirin or other antiplatelet agents are essential for those who already have documented plaque. That's because they prevent platelets from accumulating over that fissure, leading to the formation of these clots, which are more dangerous. But once again, this always has to be requested and prescribed by the doctor according to your individual case. You should never use any medication just because a friend, parent, or cousin of yours used it and had good results. That could be dangerous for you. It's also super important for us to remember that plaque is very much related, once again, to the fuels of atherosclerosis, which are uncontrolled blood pressure and uncontrolled blood sugar. So keeping your blood pressure under control is extremely important, preferably below 120/80. That would be ideal. Glycated hemoglobin should also be controlled. If you suffer from diabetes or prediabetes, this is very important. And doing this is not something arbitrary. Studies show that endothelial cells become very stressed when blood pressure is high, when glucose is high and uncontrolled. And this oxidative stress impairs the natural elasticity of the artery wall and increases the risk of platelet aggregation. So remember that I have an entire playlist here on the channel about how to improve your blood pressure, and another playlist on how to control your blood sugar. And also remember that having a good diet and a healthy lifestyle will help you in this regard. It's also important to know that in some cases, a medical intervention may be necessary, in which the doctor inserts a small tube to help remove or compress the plaque. This is usually done through a catheterization procedure or another type of surgery. A stent may or may not be placed in the artery, and the doctor will determine whether this approach is indicated in your specific case. Usually what the literature says is that when the blockage exceeds 70% with symptoms or 80% without symptoms, the risk of stroke increases significantly. So depending on the case and the progression of the plaque, the doctor may recommend surgical treatment. This surgery may really be necessary. And these surgeries are usually performed by vascular surgeons, neurologists, and they restore the blood flow without the risk of the plaque breaking off. So maybe it's important in your case to get a diagnosis. So how am I supposed to know if I have this increased plaque in the carotid artery or not? Usually, the test ordered by the doctor is the Doppler ultrasound of the carotid and vertebral arteries. Because it's a method in which the doctor who will perform the exam will specifically check the blood flow, the degree of narrowing. People over 55 years old with risk factors such as high cholesterol, diabetes, hypertension, smoking, or a family history may be recommended to undergo this test. And in fact, if you have already had a mini stroke, because many people have a pre-stroke before having an actual stroke. So any kind of doubt you may have, it's extremely important that you see a doctor or cardiologist. They will evaluate you clinically in the office and determine whether or not you need to take this test. If they tell you it's necessary, do it as quickly as possible, because this can save your life and greatly improve your quality of life. I want to know if you already knew about these 7 steps that can help you prevent the formation of plaque in the carotid artery and even reverse it in some cases. What are you going to change today? I'd love to see your comment. Remember to like the video, that's super important to me. And share this video with anyone who needs this information. Let's expand this chain of kindness together. That's what I want here on the channel. See you next time. Bye.